The purpose of this video is to demonstrate how to perform Doppler blood pressure. A Doppler is a small, portable, handheld device that uses ultrasound waves to make a pulse easier to hear. This is helpful for patients with traumatic injuries or shock. We also use this for patients whose pulse is difficult to hear with a stethoscope due to swelling, obesity, or blood flow problems. It is the primary way that we detect blood pressure in patients with ventricular assist devices. To perform a Doppler blood pressure, you will need a Doppler device, ultrasound gel, paper towel, and a manual blood pressure cuff. Before you start, please sanitize your hands. We typically perform Dopplers at the brachial artery. We will also demonstrate how to take it at the radial artery in case a patient's brachial artery is too difficult to locate or hear. To start, position your patient's arm on a pillow or supportive surface at heart height with the palm facing towards the ceiling. Place the blood pressure cuff on the patient's arm and use a quarter-sized amount of ultrasound gel at the area of the brachial artery. Turn the Doppler on and use the wheel on the side to adjust the volume up. Securely hold the Doppler head over the brachial artery, being mindful not to press too hard as you can occlude the artery. Slowly move the Doppler head around until a pulse is heard. If you have difficulty locating, adjust how far away or how close to the body the ultrasound head is. The sound will be similar to an alternating whooshing sound. Do not let the Doppler head move while you inflate the blood pressure cuff with your other hand. You should inflate the cuff to about 30 millimeters mercury past the level that the pulse is no longer heard. While keeping your eyes on the blood pressure gauge, slowly release the blood pressure cuff. When you hear the first alternating whooshing sound, that will be recorded as your mean arterial pressure.
102.
In certain cases, you will need to use the radial artery. Your setup will be the same as performing a brachial artery Doppler blood pressure, but you will place the ultrasound head at the patient's wrist near the base of the thumb. If you have difficulty hearing, adjust the position of the ultrasound head until a pulse is heard.